Sir Jonathan Michael's joining us then, and it's all about this report into the health system. I use the word with the health minister. It is quite damning. I mean, you came out there. You just said morale is not good. The management is certainly compromised. I don't know you didn't use that word exactly, but we've had 2 resignations, and I know you're not going to get involved in that side of things. Let's deal with this though. You've run NHSs. You know, and you therefore you've got comparisons. How does the Isle of Man rate when you came here? And let's just start with that. And how's it looking now?
Well, as I say in the report, there are a number of areas in terms of where I have significant concerns around quality and safety, and those are recognised sometimes by the people on the island delivering care, that they're working within a system. I think the system within which they are working actually is designed to make it more difficult to deliver high quality care, which is why I think the system needs to be redesigned in the way I outline in the report. Morale
being low, you said that on the record there, it's in the report. I mean,
Yes, no.
Is that in general? Is there certain?
I think morale is relatively low because people don't feel engaged. Ideally, what you want to have an organisation where there is a shared set of values, a shared set of behaviours. Everybody's trying to do the same thing, and people feel engaged and empowered to get on and deliver services. What we've got at the moment on the island is a relatively hierarchical, bureaucratic structure, which makes it difficult for people that are trying to deliver things in a different way to get on and
how do you break that? I mean, your report says obviously ways forward, but it's pretty entrenchment is one of those things, and you must have dealt with it elsewhere. It must be very difficult to deal with.
Yes, you engage people. To be quite honest, you engage people, but you engage people from a position of having the authority and the tools to deal with areas of reluctance or poor performance or downright obstruction, putting it bluntly. So, and at the moment I think the regulation and the legislation on the island doesn't give the managers the sort of tools that are necessary to manage the service properly.
And you've come up with this Manx care system. You change of direction. Is it another tier of management going to come in there, or just rearranging the deck chairs slightly?
Well, I don't like either analogy.
No.
Basically, it's taking functions that actually currently sit within the Department of Health and Social Care and moving them into an independent but public sector body, which is appointed by government and is set up to run services, whereas the Department of Health and Social Care develops policy and strategy and effectively commissions Manx Care to deliver things.
Cost more or some amount of people, or is it neutral?
I think it should be cost neutral. If anything, it actually should improve the efficiency, because all the functions that would be sitting in Manx Care currently sit in the department. So they need to be provided, but there's no reason why it should increase the bureaucracy.
This transformation programme, it could last years. I mean, 5 odd years, you say more?
Well,
maybe? I mean,
yes. I mean, it's not a.
This is a super tanker being moved, is it?
Yes, it's not going to be solved in 6 months. So I think we're looking at something which is a number of years in terms of programme and turning things around and changing things. So it's got to be developed. I've put in the report outline about an implementation plan, which I approach that I can, but even that needs to be developed much more and taken forward, and that will need help from people who are expert in transformation and skilled in that area.
Why are things so, I don't know, I mean, you mentioned the drugs thing. The drugs here cost more than in the UK, or they shouldn't be, or something. What was your point on that?
The point is that the Isle of Man is spending 33% more on drugs per head of the population than elsewhere.
For more drugs, or just the same amount of drugs per head of the population?
They're buying the drugs for the same price.
Right.
And so it's actually the way the drugs are used that is causing the cost. And
is that mismanagement then?
I don't think it's mismanagement. It's a missed opportunity.
Right.
So what you should have is a formulary which says we will use these drugs for these conditions, which is used across the island. At the moment, you've got different formularies depending on whether you're working in general practice in primary care or whether you're in the hospital. And then medicines management is the process whereby you monitor how effectively drugs are being used, and to be quite honest, whether people are using too many drugs. We already know the dangers of overuse of antibiotics, and the increased risk of antibiotic resistance. At the moment, it's difficult to know who's prescribing what, and therefore, if people were prescribing too many, you can't intervene.
Overall, again, back to how we started almost with rating other health NHSs. How did you out of 10? Could you give it a mark even? I mean,
I honestly don't think it's helpful to try and synthesise it down.
How would you do it in a report? Though, would it be could do better, or D plus minus?
What I've said in the report is that there's a strong group of people committed to providing good quality care, that actually there's a government ambition to develop an integrated health and care system, but actually the system as it's set up at the moment is getting in the way, and there are some cultural and organisational things that need to change. So yes, the report is quite critical. I've deliberately been quite critical, but I've also said that the vast majority of staff working in the system, whether it's in the public system or whether it's privately or supporting through charities and the third sector, they're all trying to do their best. The system at the moment actually isn't helping them.
Right.
So I'm being critical of the system, not critical of the staff.
Is that you now done? Are you walking away from this? You've been paid your fantastic salary, no doubt, and that's it? Or do you want to keep involved, or have you been asked to keep being involved, or what happens? Do you just hand it over? Because I know Tynwald have got a vote, and you've asked them to take it all, not piecemeal it.
Absolutely. I've suggested that Tynwald, I've recommended to Tynwald that they accept all recommendations, and indeed the government has made it clear they're asking Tynwald to support all recommendations.
I suppose I'm asking, would you want to come back and keep it going, or are you going off into retirement, or again?
Again, well, as you know, I'm already retired.
Yes.
But what I have said, and how the implementation of the programme is taken forward is clearly a matter for the government now, assuming that Tynwald supports it. What I have said is I'm very happy to have conversations with them about how I might continue to support them in a way which is realistic in terms of what I want to do, and realistic. Ultimately, this programme needs to be delivered by the Isle of Man.
Okay.
People need to own it, and they need to deliver it. I'm happy to continue to support them.
And I'll be talking to Alf Cannon about that in another interview. But would you see that you'll be needed again? Let's try that.
No, I don't think so.
Your job's done.
I was asked to do a review and write a report. If I'm asked to continue with some form of further engagement in an agreed way, then I'm happy to have that conversation.